Hi, my name is Bob Elder. I'm a registered pharmacist. I've been practicing for 16 years, and throughout my entire practice, I have counseled patients. I have put my entire heart and soul into helping people overcome the dangers of medication non-compliance. And by means of medication non-compliance, I'm talking about improper use of the medication. Now, IAMH has asked me to talk about this because, quite frankly, I wanted to point out that medications is just a part of the many variables of treatment that a person with mental illness can receive. In addition to exercise, diet, coping skills, stress management, medications take their place along their side also. Medications are to be considered as tools. They're not to be considered all by themselves the only thing that's going to take care of the mental illness, but just as tools you would use in concert with other things. But back to non-compliance, we realize that people are not taking their medications properly. In the United States alone, $100 billion a year are spent on people who are rehospitalized or have toxic events or even die as a means of not taking their medications properly. Now, the watchword here is that medications are only as good as you would take them. If you don't take them properly, they're not effective at all. Now, one of the main things that people realize is that they take the improper dose, they take it at the wrong time, they take sometimes the wrong medication altogether. And this is what costs. People who have mental illnesses have a particular hard time in dealing with medications, mainly due to the cost of the medications and the side effects. Side effects are very prominent in a lot of these medications. But nonetheless, the physician and the person with the mental illness have to work together to find the right medication that's going to work the best for that person. And oftentimes that takes the choice of a drug that perhaps lasts the longest period of time in the body. It's called the longest half-life. And also choosing the simplest regimen is very important. It is often a problem when a doctor prescribes a pill that's taken 4 or 5 times a day. If that medication can be taken once a day, you can see how much more easy that's going to be. Another thing is that people also look at medication from other aspects also. If I were to be free of symptoms and haven't had any problems with clarity of thought or mood disorders or anything, then I'd ask myself, why do I have to take this medication? I'm feeling great. I don't need to take anything anymore. But that's where the problem comes in. Even though the symptoms may be taken care of, the person still has to be on the medication and taking it regularly. A lot of people don't do that. They stop, and then the symptoms reemerge, and the illness then takes its effect. Now, to ensure the compliance, we ask the doctors to help communicate with the patient better. The doctors and the patients have to understand what the medication is and what their illness is before any regimen is undertaken. The costs of non-compliance are staggering. $100 billion a year are spent in America all alone because people are not taking their medications properly. They're either taking the incorrect dose, incorrect medication altogether, they're not timing the doses, or they're not taking the doses frequently enough. And any of these will just tear down the person's therapy. Now, in addition to this, we also have another set of reasons for noncompliance, and that is cost. We all know that medications are very costly nowadays. Another reason would be the lack of understanding of the medication and the illness. And this is something that IAMH wants to try to research and get a point across to people to help them understand what the illness is all about. If I'm having a illness that doesn't have any symptoms, then I'm going to find it difficult for me to take my medication because I don't have any symptoms. But the fact remains that I must still take the medication in order to take care of the illness. Another thing is that some people lack the belief in treatment. And another thing is that people miss their appointments, or the doctors do not discharge the patients properly or have correct follow-up. Any of these factors can yield disastrous results with their medication compliance. To ensure the compliance, the patient and the doctor must work together. The patient must make a firm commitment to take the medications as prescribed. The doctors must make a firm commitment to understand which drugs to take, which ones that last the longest in the system, the ones that have the best side effects profile. The communication between the doctor and the patient is paramount, because if the patient does not explain to the doctor how he or she feels, the doctor is not going to be able to select the right medication at all. Helping the patient to better understand the illness and its treatment and how to monitor the adverse effects is critical also. You know, this is part of my job as a pharmacist, to ensure that people take their medication properly. I've had it drummed into me not only as a student but throughout my career as well. It's my responsibility to make sure that people take their medication properly. Otherwise, the adverse effects and the problems with the adverse effects are just tantamount. The thing is that I'm not only just telling you as a pharmacist, but I'm telling you as a patient. I'm telling you as a consumer with 35 years of bipolar disorder. It took me a long time to get through all of my schooling. I've had 9 years of college schooling, and many times I had to give up my college semesters because of my mood swings. There was a struggle at times trying to get the entire process of my learning under my belt. There were times when I had a very difficult time trying to understand what was given to me simply because of my illness. But one thing I always remembered was that despite everything that I had to struggle with to get through my college education, knowing that someday that I'd be able to return the favor, to reach out and help other patients with this knowledge was my goal. Even though I'm not working anymore behind the retail bench, I am still now doing what I do best, and that's counseling patients. This is what I really wanted to do, and I'm glad that International Alliance for Mental Health has got me right where I wanted in this new niche as a